Hello, Dr. Hill here. A video coming your way. We're going to do some more stuff, some fun stuff. I know you've seen these videos before. These are the ones where we get questions off of a AskADentist thread on Reddit. And these are actually usually great questions, interesting questions, and questions, honestly, that most dentists probably see on a regular, daily, if not weekly basis. And we're going to kind of go through them. We're going to look at them. You guys know the drill. I haven't seen any of these, so we're going to kind of get the actual on the fly response and the real response and kind of go from there. So it's going to be more of a kind of a discussion rather than anything, but it'll be interesting. So we'll have to kind of take a peek at these questions and we'll go through them together. All right. First one, tobacco-free nicotine pouches. I used to vape and had to quit after I got walking pneumonia. Good start. Kind of like where that's going. I started using Zyn nicotine pouches at 6% nicotine every pouch. I go through several pouches a day, switching sides of the mouth, right, upper, right, lower left, upper left, I think is what we're going for. Approximately 8 a day. 8 pouches a day. Dude, wow. I know it's not healthier than quitting altogether, but what are the consequences of prolonged use of these pouches? Something I should really try to quit or something to just think about? You should try to quit. Anything involving nicotine, it's obviously a addictive habit. 8 pouches a day seems extremely aggressive and a lot to me. That can cause at some point some major issues. And I've got a lot of training in this because I was at West Virginia for 9 years. So that's a big thing down there, is any type of chew, dipping, anything like that. So there's a lot of information that's coming out of that area that is kind of giving us some more of this research that we can know. But I will tell you a couple things on this. Number one, any type of tobacco product, nicotine, whatever it is, could always cause you major issues in your health. Systemically, obviously, people know about the smoking in the lungs, and all that kind of stuff. Even in the mouth, with oral cancer, things like that. These pouches, chewing, dipping, chaw, vaping, whatever you want to throw out, it can always lead you to issues, okay? I am going to give him 1 little ounce of credit, because if you do go to a dentist that understands the potential use of chewing tobacco and whatnot, he is doing the right thing by switching the areas of where he places his Zyn nicotine pouches. Most dentists will tell you to do that. The reason why is because of the way that the tissue changes over time. We don't really like patients to kind of keep a nicotine pouch, if you're going to do it, in one area at all times, because the tissue goes from a keratinized to non-keratinized and vice versa, which I know that's kind of some gibberish stuff, but basically what it means is it can be bad. It can cause problems. It can cause major issues. And that's why we do oral cancer screenings, obviously at every single appointment that we see patients, just to make sure that nothing is kind of going on or having any issues or anything like that. I will kind of throw in a little caveat here of a little thing that we've kind of learned and known on this chewing tobacco is actually a lot of patients that, whether it's the smoking cigarettes, the vaping, the dip, the chaw, any of that kind of stuff, not only is the nicotine kind of an issue, but it's actually a habit issue. And what I mean by that is they've kind of done all this research where they've known that a lot of patients, even if they, like, let's say they're trying to wean off cigarettes or they're trying to wean off the dip, if they use something in that hand motion, right? Like, so if I'm used to doing this all the time, that's also a major issue. Not as only the nicotine issue, but it's also the habit of doing that. Same thing for people that chew or dip. It's the habit of having something in the mouth and having something that they can either spit out or whatever they do with it. It's just a habit. It's something they've become used to, just like any of us have our habits as well. There is a great product out there. There's actually quite a few great products out there. Just like I know most of you have seen, like the Nicorette patches and the gums and all that kind of stuff that's trying to help wean people off of smoking. There's great products out there that are actually made for this exact person that is trying to wean off the dipping and the chewing and all that kind of stuff. And basically the thought process behind it is, you get this product, and there's a couple out there. You get this product and you mix your normal dip or chew or pouch or whatever it is. Then you put this other product with it that has no nicotine or anything in it, but it is a very substance-like. It's kind of the same texture, feel, all that stuff. You mix it together, you place it in the same spot. As you go on, the next day you kind of get rid of a little bit more of your dip or whatever it is. Then you kind of go adding more of the non-nicotine substance. And it goes on and goes on and it goes on. I know actually a bunch of patients that have this non-nicotine substance that they use all the time now with no dip, no anything, but they just use it because they are used to having that habit and that feeling, that ability to do what they want to do. So to me, there's ways to get rid of it. Yes, at some point, could this cause you major issues? Absolutely. You're dealing with some type of a toxin with a nicotine, an addictive kind of thing. You're not really taking care of the tissues, things like that. This can be a major issue for you at some point. So yes, I mean, 8 pouches a day is insane to me. That's got to be literally all day, every day. And at night, I mean, it's just got to be a habit kind of thing. So maybe looking at something where we can kind of wean off of that down to 7, down to 6, down to 2, and then kind of going down like that, you might be more beneficial than just trying to cut cold turkey, because it seems like that's not really working. So this is a great question. I could talk about this stuff all day. Great question. Gum recession question. I was looking at my teeth and I noticed some gum recession with some of my top teeth. I was wondering if it is normal to see gum recession in my early 30s. I've seen people with gum recession when they were 12 and 13. So it is possible. There's many reasons behind gum recession. We used to know, a lot of the times in old school days, you used to do a hard bristle toothbrush. People like the scrubbing aspect of it, which can cause issues in your gums. One of the things that we're seeing nowadays is people are doing a lot more clinching and grinding, which can cause those gums to kind of recede down and show more of the substructure of the tooth than we want. And we're starting to notice that a lot more. On the positive aspect of that, we have a lot more things nowadays with materials, technology, things like that helping patients fix gum recession is a huge, and it's an easier way now than it's ever been in the past. And you can get a lot of benefits, a lot of healthy things going from it. But is it normal? It's normal. Do we want to see it? We don't want to see it. We want to try to avoid it at all costs. So talk to your hygienist. They always have some great ways to help potentially avoid things worsening like that. Or also talk to your dentist. Obviously, they have some things that they can kind of discuss and go over. Invisalign. I started Invisalign somewhat recently and am supposed to be on tray 3, but I've barely worn 1 and 2. I can't go back because I don't know where they are. And I was wondering if it's okay to skip directly to 3 because I don't have many options. Happens a lot. You would be shocked. I will tell you, there is a reason why Invisalign goes trays in order 1, 2, 3, 4, all the way up to whatever it is. It is because what we like to do is we like to make small movements, small calculated movements, rather than making these huge big jumps. When patients make these huge, or orthodontists or dentists, whatever it is, when they make these huge big jumps and they move teeth at such a fast rate, there's bigger issues that come behind it. The teeth actually shorten, the roots will shorten. You could potentially cause more mobility or looseness of your teeth. To me, I stress to my patients, if they ever lose a tray, to call me right away, because Invisalign is all digital. I can call Invisalign, hey, patient is on tray 4, they lost it, we need a new one. They can't go back. I don't want them skipping ahead 3 or 4 trays at one time, all that kind of stuff. It is dangerous. Now, again, in this patient's case, a couple trays, he might be okay. He or she might be okay. I've seen some patients that wear like tray 1 and 2 for a lot of time, and they skip to like 5, 6 because they don't want to wait as long. That is just a bad thing to do. You're going to have, first of all, you're going to be in pain. You're probably going to cause your teeth to be loose. You're going to cause bigger issues, underneath the bone structure and things like that. So for me, whoever started this Invisalign or whoever did that, they are used to people losing their trays. It's not a big deal. Call them. They will call Invisalign, get you kind of set back up. The dangerous thing about Invisalign is if you are not wearing your trays the amount of time that you should be, right? Invisalign tells us 22 hours a day. So what I tell my patients, if you're eating or drinking anything that's not water, your tray should be out for that time, okay? I have seen patients, and I have patients that, they are not very compliant with their Invisalign. They wear it a couple hours a day. They kind of, they might switch trays when they're supposed to, all that kind of stuff. They're kind of very lax about it. That is going to cause issues with your final result. So a lot of times patients think if they wear all their trays really, really fast, that they're going to get to their end result quicker, which they might, but it's not going to be healthy. Or I have the complete opposite, where they wear their trays here and there. If I wear it when I'm sleeping, it's probably going to be enough time to move the teeth, things like that. That's not the case either. Invisalign and all these clear aligner products and stuff like that have done so much research, so much time, money, and effort spent into figuring out what works best and how to make these teeth move, that it is one of those things, and I'm a rule breaker at times, whatever. It is, I don't break the rules on this. You wear them all the time. You go at the pace that you're told with you and your dentist or your orthodontist, and then you build off of that. You're going to be in much better shape. You're going to be much healthier. And the thing is if you take it the right way and you do it the right way the first time, you're never going to have to do it again, which is obviously the ultimate goal, because anybody has braces, you don't want to do it again. That's just the way it is. To me, when you're moving teeth and you're changing a full structure like that, slow, smart, calculated moves are the way that you can get a long-term answer and success from that. To me, you're in a danger zone if you just skip right ahead because you just don't have other options. Hopefully you have other options. So to me, call the dentist, get some new trays, start over, go from there. Crown fell off, implant abutment. While flossing last night, my crown fell off the abutment of my implant, front left tooth. I managed to salvage it before it was lost down the drain and quickly secured it back on. It feels fine for now, and I left a message with my dentist. Likely won't be seen until Monday. Should I be very concerned? Any advice appreciated? Happens all the time. All the time. Whether it's implants, implant crowns, whether it's crowns that are on natural teeth, it happens all the time. This is a part of dentistry that's frustrating for the dentist. It's frustrating for the patients. It's a frustrating thing. To me, if you have the crown, you're off to a great start. I've seen many people lose their crown, swallow their crown go down the drain like you said. If you already have the crown, you're in a good spot, okay? I would just baby it until you're on that Monday schedule. Just baby it. A lot of the times, the way that these teeth are prepped, the way that these things fit, you are going to be fine as long as you don't wait long term to get back into your dentist. Sometimes the dentist will look at it, they'll try to move it, try to remove it, try to do any of that stuff. If it's on there, they're going to let it stay on there. And they're going to let it do its thing until they need to re-cement it and or screw it back on, or however that implant is supported. But do your best to baby it as long as you can until it looks like Monday. Hopefully you can get in. But being very concerned, as long as you're taking care of that area, whether it's an implant or natural tooth, you should be fine. As long as you don't have any pain, discomfort, anything like that, you should be fine. Good question, because that happens quite often. Okay. Reddit, more questions. I like these questions. These are great questions. It is kind of nice to switch it up and actually do a real dental conversation, because I know we do a lot of fun stuff on here. But I'm hoping that you guys are enjoying it as much as I do. Please send in some more comments. Like I said, we got this off the AskADentist thread. If you have some questions on there, or if you just want to ask this question straight to me instead of on the Reddit platform, I will gladly read them off to you and get a video going for you right away, and we'll respond back as quick as we can. So like, subscribe, comment, send stuff, do the whole thing. I appreciate you guys. I'll see you soon.